the more dense the breast tissue, the less sensitive the mammogram may be. So the sensitivity of mammography can be as high as 90% or more in a fatty breast or even in a scattered breast pattern. But when you're moving into the heterogeneously dense and extremely dense category, the sensitivity of identifying a breast cancer may be as low as 50 to 60%. So definitely, we're not as good in the more dense pattern as we are in the more fatty patterns. That's where tomosynthesis, digital breast tomosynthesis may be helpful. Also screening breast ultrasound may be helpful for the patients with dense breasts to get that sensitivity up higher and to make sure we're not missing any cancers in the dense tissue. No, I think once a cancer is identified, having dense breasts does not pose an issue for us. It is to get us to the point of identifying the cancer. So it may be a little bit more challenging if there is something that may be hidden in the dense breast. But once a woman that has dense breast is identified with breast cancer, additional ultrasound, biopsies, MRIs are done. And so we have other methods to penetrate the dense tissue and really look and make sure there isn't another lesion. We worry in dense breast once a cancer is identified that there's a small percentage and a chance that there may be additional lesions, whether in the same breast or the other breast. So MRI becomes very important. So once we identify a patient with breast cancer, certainly if they're young, less than 50, premenopausal, and they also have dense tissue, we do a risk assessment evaluation on them to find out if they are, if they're at risk, for additional cancers, and also for, to possibly recommend genetic testing to them. So we do a risk assessment, we evaluate them, we offer them breast MRI after a new diagnosis of breast cancer. Frequently, those patients have genetic testing, so they can find out, what their overall lifetime breast cancer risk will be. Breast density is important for the referring physician to know, and it's important for someone to explain it to the patient. Frequently, in the United States, the radiologist may be explaining the breast density to the patient when they come in to have their mammogram. In other countries, it may be the referring physician or the patient's primary care physician that explains it to them. But it's important for the referring physician and for the radiologist to be in close communication and the report to be as accurate and thorough as possible. So breast density is something that's very important for the patient, and it does need to be identified in the report, in every report, every time the patient comes in. The trials that we all talk about when we get together are all based on mammography screening. So mammography screening has been our gold standard. But there are more and more studies that are coming out where MRI may be the thing that we go to for screening. It may be years down the line. I don't know how we would do it for everyone, but it may be a combination of mammography, ultrasound, and/or MRI, depending on the risk level of the patient.